Us today for our Rittenhouse Online Open Course. We do these from time to time, and we're really excited to have you joining us today. I'm Nicole Gallo, and I'll be introducing our panel in just a moment. Today's topic is Doody's Telehealth Special Topics List, a trusted collection development tool during COVID-19. Okay, so we appreciate you joining us today. And just to get us started, I'm going to talk a little bit about what we'll be discussing. We are going to provide an overview of some current trends with telehealth. We're going to have a panel discussion covering some topics around telehealth and the impact that COVID-19 has had on telehealth practice, collection development needs, and where you can access some information. We are going to hold a Q&A session. So this is going to be recorded, this session. It will be available on our YouTube page, and we have the audience silenced just for ease of all the participants. But if you have questions, familiarize yourself with the toolbar and you can type your question in. We'll be monitoring those throughout the sessions, and we will reserve some time at the end to review any questions that are submitted. So we do encourage you to submit questions. We have a great panel and a lot of experts on the panel, so now's the time. Okay, I'm Nicole Gallo, as I mentioned earlier. I am the Executive Director of Sales and Marketing for Rittenhouse Book Distributors. I work very closely with our sales team as well as all of our customers, our hospital and library partners. I work with our library services department as well. I've been with Rittenhouse, this is my 26th year, so I know a little bit about the distribution business. And I have a BA in Speech Communications from Miami University in Oxford, Ohio. I felt compelled to add that because all of our panelists are so esteemed. I had to put in my credentials. Okay, so I'm going to have the panel introduce themselves. And so I'm going to turn it over to Tim to give you a little overview of his background.
Well, thank you, Nicole. I appreciate this. And before I get started, I just want to thank you and Laura and the Rittenhouse team for putting this together. It's an honor to be here, and Doody's and Rittenhouse have had a long-term relationship for many years, and we're grateful to be here and for your support of the Doody Special Topics lists. But as Nicole mentioned, I am Tim Butzen-Cahill. I am the general manager at Doody Enterprises. And as the slide suggests, I oversee the day-to-day publishing activities of Doody Enterprises, including the Doody Special Topics list, but you may know us from our other services, Doody's Review Service and Doody's Core Titles. I'm a recent MLIS graduate, so I consider myself a librarian, but I work on the publishing side of things. And before this, I worked with biomedical and clinical researchers in their research spaces. So thank you.
Wonderful, thank you. Okay, and Kelsa, we'll turn it over to you.
Hi, everybody. My name is Kelsa Bartley. I am the Education and Outreach Librarian at the Calder Medical Library at the University of Miami Miller School of Medicine. I'm also a recent graduate of library school. I graduated in 2018. Before that, I did photography, so librarianship is actually my third career. My role includes, at Calder, includes teaching and education and doing research activities, as well as outreach and promotion of our services. I was selected as one of the title selectors for the special topics list, the telehealth special topics list, which is why I'm here. And fun fact, in 2018, while I was a library student, Rittenhouse has this excellent award for unpublished papers, and I was the recipient of that award. For my paper topic was use of mobile apps for self-management of diseases, which made this being on the Doody specialist for health, telehealth, really tied into my research for that. Thank you so much.
Yeah, and that was a surprise because I hadn't remembered that. Of course, I didn't put two and two together. So we are glad that you were the recipient of that award, and we hope to be back in person to be giving that award again soon for sure. So thank you. Okay, Tabitha, I'm going to let you introduce yourself.
Hello, everyone. My name is Tabitha Anglea, and I am a master prepared registered nurse with a variety of clinical expertise. A member of the AAACN, served as the co-chair and co-editor of the Scope and Standards of Practice for Professional Telehealth Nursing, the 6th edition. Also a co-chair of the active development of the online telephone triage course. I also serve as a member on the leadership committee, clinical manager at HCA National Contact Center Management Group. Also created and developed and led our NCCN Clinical Shared Governance and its Operations, Quality, Education, and Practice Councils. And I'm glad to be here. Thank you.
So I guess you don't have much free time, right? So we really appreciate you guys joining. Okay, and Cynthia, we'll turn it over to you. I have to say, you know, last week we did a little practice on this webinar and everyone dialed in from their spring break. So I really appreciate all of the dedication to our seminar. But I'm going to go ahead and let Cynthia introduce herself now.
Hi, thank you very much. I'm glad to be a part of this group. I'm a board certified ambulatory care nurse. I've been nursing for over 29 years. Currently, I'm the primary care clinical nurse advisor for the United States Veterans Health Administration, the Office of Nursing Services. I received my Bachelor in Nursing Research from the University of Dundee in Scotland. As a member of the American Academy of Nursing, I was wonderfully partnered with Tabitha in going ahead and doing the revision for the telehealth scopes and standards that we are speaking about today. I've also chaired and edited the scopes and standards of professional practice for care coordination, transition management, and ambulatory care nursing revision of 2017, and will be revising the 10th edition for 2021. An inaugural member of the Ambulatory Care Nursing Sensitive Indicators industry report that was published in 2016, and also the role of the RN Ambulatory Care Position Statement for 2017. A member of the Veterans Administration Special Interest Group of the American Academy of Ambulatory Care Nurses, AAACN, and also a member of the Leadership Special Interest Group as well. That's it for me.
Well, thank you very much. We appreciate that. So everyone can see we have a really robust panel, a lot of experts on our panel. So I'm going to get through some of these high-level trends pretty quickly so we all have time to hear a little bit more about the books informing telemedicine and also the Doody special topics list. So I think everyone's aware that telehealth really does enable healthcare workers to stay connected to patients without an in-person visit. So it's audio and increasingly and more frequently video technology. Of interest, each state has its own set of regulations that primary care providers must follow when conducting telehealth visits. Something I didn't know until I started researching for these slides. Of course, COVID-19 has forced, you know, an immediate ramp up of telehealth services, which we'll be talking about today. And while it may seem like a temporary solution, I think it's definitely here to stay, and we'll hear more about that too today. But it really is one of the top 10 trends right now in healthcare. So it is here to stay. And in some surveys that I was able to dig up for this session, according to the American Hospital Association, about 74% of patients in the US said they would use telehealth services. And 74% of patients are comfortable with communicating with their doctors using technology instead of seeing them in person. So I don't know how many of us on the line have actually used telehealth services. I know I did during COVID-19, and it really was convenient to just, you know, set aside 15 minutes to have my visit versus, you know, having to go into the office. So I can see how that fact is true. And 67% of patients said that using telemedicine somewhat or significantly increased their satisfaction with medical care. That's really interesting to me. And I think it's that undivided attention that the patient feels when they have that one-on-one interaction online. So, according to Fair Health, and this is really before COVID, pre-COVID, already private insurance claims for non-hospital-based provider-to-patient telehealth grew by over 1,000%. So you can just see the explosive nature of telehealth medicine. And I'm sure when we look at, 19, 20, 21, it's going to be even greater. And telehealth has really been driving a rise in new devices. So technologies like telemonitoring devices, home messaging services and monitoring centers, voice recognition, all of these things are going to be used to streamline telemedicine. So your physicians and your nurses are going to be able to monitor what's going on with your health from a distance. I think it's here to stay, but I also think that research would support the fact that there's going to be further innovation and disruption. So there's going to be continued innovation with the Internet of Things, the IoT, and connected devices. So there are all these new telehealth focused companies cropping up. When I did my research on this, it was unbelievable how much information and how many different companies are out there. And then you're going to have large companies like Google, Apple, Amazon, and Microsoft finding ways to contribute and innovate in this space. So I know Amazon has already launched a telehealth division in Washington State. It's probably, their testing ground. But I think we're going to continue to hear a lot more about this. And the other key trend here is that it's decentralizing healthcare. So as healthcare professionals prefer flexibility, there'll be a continued trend towards that decentralized healthcare. So I think we're going to continue to see, a larger health system offering a variety of services for more locations, or even, completely remote services being offered. So that's just a little bit on the trends. And at this point, I have a little bit more here. People are more likely to engage with the healthcare system. So that's one of the benefits and challenges that telemedicine provides. So patients are more engaged, but health systems have to be able to meet that need, and information has to be out there to meet that need. There are decreased costs. So remote patient care decreases the overhead costs of the medical visit. So that's definitely a benefit. You're able to better manage no-shows because you can just roll right into the next patient. So providers are also able to bill for unanswered phone calls and even extend their hours because of telemedicine. So there's a lot of opportunity and also a challenge there, because you have to have staff that's willing to be online 24/7. And it is providing improved workflows and efficiencies. Patient care and delivery can be more quickly prioritized. And I think even as, patient care being patient-centered, your standard check-in can just become more efficient. So there are definitely some benefits as well as challenges with these telemedicine trends. Okay, so now I'm going to turn it over to our panel. Enough about the educational part of the session. Let's get to the interesting part. So we're going to roll through with some questions. And again, if you have questions for this panel, we would ask you to enter them on your Q&A on the sidebar on the GoToWebinar, because we are reserving some time here at the end. But we're going to turn it over to Tim now to talk about some trends in collection development and what precipitated the telehealth special topics list.
Sure, thanks, Nicole. So I want to talk a little bit about the background for the Doody special topics list as a collection development tool in general, and then I'll talk a little bit about telehealth a bit later. But I just want to start by saying that Doody Enterprises responded to the COVID-19 pandemic by creating a labor of love COVID-19 book list that was aimed at the first responders and the librarians who support them. The idea was to provide a list of resources that could potentially be useful to health professionals as they began navigating the uncertainty of and responding to the pandemic. The book list was comprised of roughly 40 books that hailed from a wide variety of disciplines such as public health, hygiene, infectious diseases, virology, etc. And when we published this list, the response was very positive. Of course, health sciences librarians with whom Doody works with quite closely really appreciated the list as a starting place for gathering resources to have on hand to support faculty and clinicians. We heard even from public librarians who appreciated the list for providing more advanced resources to augment their consumer health collections. And then, of course, we also heard from health professionals who validated many of the resources on the list and offered their own suggestions. And so our work developing and disseminating the COVID-19 book list demonstrated to us the strong desire for book lists that responded to timely topics and issues within the health information ecosystem. With so many books published each year, a book list centered on a single interdisciplinary topic of high importance will help librarians focus on developing high impact collections, as well as provide reference and reading material that for other people who are eager to learn about emerging topics in the field. That's really the basis upon which we built the Doody Special Topics list. But in terms of collection development trends, I really think that in library science, we talk about the just-in-case versus just-in-time model of reference. And I think Doody Special Topics list really lean into the just-in-time model, where we're providing resources that address a timely issue and information needs of health populations in a variety of settings. And again, going for high impact resources. And of course, I would be remiss not to mention that over time, library budgets have been cut time and time again. And so having a list of high value resources that are timely and important for immediate needs is really responsive to the needs of collection development librarians.
Yeah, absolutely. It makes a lot of sense. And especially too, as everyone's locked down, I think, you know, having a go-to list makes perfect sense.
Definitely. Yeah. So
Okay,
I'll let you go to the next person, Nicole.
Sure. All right, so we're going to go to Kelsa now and talk about what some of her major considerations were as she looked at the selections for this special topics list from Doody and Telehealth.
Thanks, Nicole. So it wasn't just me choosing
Sure.
this list. There were two other librarians involved in selecting the books that we eventually all selected. But one of the most important criteria was the age of the books. As Tim mentioned before, we wanted to make sure that all the books that we selected were relevant to the times. So most of the books that we selected were older than 2015. Actually, a lot of them were actually published in 2019 and 2020, which means they were in the pipeline probably a couple years before that, before COVID. So I was kind of surprised to see how many books on the topic were fairly on the topic of telehealth were fairly recent publications. Another aspect that I used to pick books was what books were kind of missing from what books were missing from on different topics. So usually a lot of the books on telehealth are very generalized, and I noticed in the Doody's collection there were a lot of specific type books, like for nursing, for mental health, etc. So I felt like these books were really important because they were impactful at the time of COVID, especially like the mental health aspect of telehealth. A third thing I did that we were encouraged to do was I went into my library's collection to see if there were books that we had that Doody's didn't have, and like what were the usage stats for those books that I felt that, you know, okay, if our people are using it, I'm sure there are other libraries who might be interested in this book. So that was one of the other criteria that I used, and I recommended. So we had we were encouraged to recommend books to Doody's as well for inclusion into the list that they didn't have already in their database.
Yeah, that's interesting. It you know, given that stat we saw with the explosion in telehealth, even as early on as, you know, 2016, 17, 18, so the publishers are probably reacting to that and got these books into the pipeline, and then
Right.
no one really knew the impact, or that COVID was coming. So it really is interesting to see how those two things married up.
Yeah.
For sure. Okay, so we're going to now talk with Tabitha and Cynthia and talk a little bit about how COVID-19 impacted the AAANC scope and standards.
Okay, thank you. So the impact, we did not see the scope and standards of the practice preceded the onset of the COVID pandemic. So these were already in place. These standards provided guidance to the health systems nationally with the expansion of telehealth services in lieu of that traditional face-to-face encounters, provided a timely access to healthcare.
Yeah.
Yeah, this is Cynthia. And so the standards they were presented prior to COVID, they presented new thinking about telehealth as integral component of today's professional healthcare practice. That's the 6th edition. Inspired by the vision and values and traditions of the past, this edition of the scopes and standards of telehealth professional nursing practice reflects current professional norms, practices, and expectations, and recognizes the constantly evolving landscape of professional health systems. So it really was impactful in the ability to respond to the pandemic.
Yeah, absolutely. Okay, so Tim, we'll come back to you now a little bit and talk about why telehealth. You covered this a little bit initially, and obviously COVID probably had a lot to do with this with regards to picking telehealth for special topics list.
It sure did. The reason why telehealth made this, so Doody is not responsible for picking the topics. We actually are guided by an editorial board comprised of medical librarians from across the United States and Canada, from both universities and hospitals. We tried to create a diverse board to help us select the topics that were most pertinent to health communities around in this country in particular. And they decided on the topic of telehealth because they were seeing a huge spike. I mean, as you've already established, telehealth is nothing new, but COVID-19 has put a renewed emphasis on it, and we've seen a growth of it over time. And so librarians responding to the needs of the health professionals that they support really needed resources regarding the provision of telehealth and telemedicine. So that's why it was selected, and I'm so glad that it was. And I hope that the list continues to be a timely resource. And we always know that book lists are outdated as soon as they're published, but I think this one withstands the test of time quite a bit, especially with the AAACN standards on it.
Yeah, absolutely. Okay, Kelsa, maybe you can talk a little bit about some of the common themes that you saw throughout some of the resources that you were reviewing when you were considering books for the collection. Anything really kind of rise to the top?
Yeah, quite a few things. One of the main things I noticed, especially with the titles, was a lot of them had to do with like apps and mobile devices for monitoring healthcare, things for monitoring things like diabetes, for blood pressure, that sort of thing. So mobile health devices and apps for health monitoring was one of the major things I noticed with a lot of the titles themselves. Another thing I noticed was like the range of specialties that these books catered for. So like I mentioned earlier, a lot of books before dealt with like standards or just general like what is telehealth, etc. But there were a lot of titles on this list or in Doody's databases that dealt with specific things like mental health, I mentioned before, nursing specifically, aging and older adults, like how do we use telehealth to monitor people with pre-existing conditions or comorbidities. Also a lot of, there are a few books on big data and robotics in relationship to telehealth. So I thought that was interesting as well.
Yeah, absolutely. And that really can help to inform collection management when you're starting to see those trends, and then the books make it onto the list, right?
Yeah.
Okay, so for Tabitha and Cynthia, maybe a question around, what your thoughts are with institutions working to implement some of the new standards that are covered in the new edition.
So healthcare institutions can definitely, implement the scope and standards within the development. So as they're thinking about implementation of telehealth, this can help with development of the structures and processes of telehealth nursing, surrounding policies, procedures, the role description for nurses, and their competencies.
That's right, Tabitha. And the standards, the 6th edition of the AAACN's standards may also be used to prepare nurses for the Ambulatory Care Nursing Certification Exam from the American Nurse Credentialing Center, which contains questions on telehealth nursing and is the recommended exam to validate telehealth nursing knowledge and expertise. And the standards also reflect a global opinion, I guess that what you would say, of experts in telehealth nursing. Not only those who are experts within this country, but also participants from the International Council of Nursing, the NHI, several other groups globally who worked on this publication with us as contributors or reviewers or content experts.
Great. And we also have another question for you two, from your perspectives, and it is unique coming from within the association and with your publications, how have you seen telehealth nursing changing?
Reflecting back on many of the challenges that we faced during COVID, telehealth and telephone triage quickly became that face of healthcare. We were all seeking ways of how to utilize it. Every organization in healthcare began innovative ideas and ways to serve the healthcare needs of each community. Our lives had changed. Scope and standards of the professional telehealth nursing, it remained the same, but it was that tool and resource. The delivery methods changed on how we provided that care. This change in delivery of nursing care allowed for the expansion of remote patient monitoring, I think you discussed earlier, virtual visits, real-time artificial intelligence, such as triage chatbots, different sessions in a way to manage those exposed or positive COVID patients. It was a different avenue to care for them.
Sure,
Yes.
yeah, I guess. Go ahead, Cynthia. Yeah.
I'm sorry. Yeah, no, I was agreeing with Tabitha. Yeah, in health systems, great and small, those providing all levels of care from birth to death. The use of telehealth technology during this global pandemic, it removed physical boundaries based upon the location of the patient and or the nurse, and expanded the practice of nursing to meet access to care. The scopes and standards of practice for professional telehealth nursing, the 6th edition provides the scopes and practice guidance specific to ambulatory care subspecialty for telehealth. The standards promote effective clinical and administrative management of the increasing complex telehealth nursing roles, responsibility in a changing healthcare environment. So it goes from the staff nurse to the nurse executive and all those in between for the development of competence and how you would reflect on that competence.
Yeah, it's pretty amazing how quickly things are shifting, isn't it?
Absolutely.
Yeah. Okay, well, we could probably talk all afternoon, but we promised to keep this to around 30 minutes. So I'm going to just briefly talk about where you can find all of this great information that we've been chatting about. And I did promise to answer a few questions, so we will do that as well. Of course, you can find the scope and standards of practice for professional telehealth nursing at the association's website and find access to the book. And I put it there, as well as, Rittenhouse has access to both the print and the ebook. We distribute on behalf of the association. So one of the things that Rittenhouse has done in conjunction with Doody is we publish the lists for telehealth. So we have on the r2digitallibrary.com a telehealth list, all the special topics lists, any of the ebooks that we have available, we create and curate those lists, as well as on rittenhouse.com for our print website. So by extension, the association's content is there. I'm proud to say we do partner with them for the ebook. So you can find that on R2 Digital Library as well as in print from us. And where to find the Doody special topics list. So you can go to Doody's website to find more information on that. And of course, we partner with and license access to publish the special topics list information at Rittenhouse. So it's incorporated into all of our websites. It's on rittenhouse.com as well as r2library.com. My red circle got a little off here, but you can see we have all of the Doody's lists right online, and you can access any of our websites and click on those lists to find more information. So one of the things that Doody's has been really good with is working with us to license that information so that we can make it readily available to all of our customers. Okay, so if there are any questions, you can submit them. I know we're right at time, but I have 2 questions here that I thought I would ask. And one is for Tim. So Tim, I think you're still on the line. And that question was, even though this was a special topics list, will the telemedicine list be continually updated?
That's a great question. I think what we're seeing as we're going through, I should say that Doody Special Topics List started we published our first in October of 2020. So this is a new initiative for us. And what we're noticing is as we're going through, there's a desire to update lists as we're going. I've heard this from list selectors. I've heard this from board members. So it's an idea that we're entertaining right now. So there's a good chance that in the next year or 2, you might see another list dedicated to telehealth and telemedicine.
Great. Well, we'll look forward to seeing that for sure.
Absolutely.
And I do have a question here for Kelsa, and it's about the apps for health devices, and do you promote those actively in your library? So, you know, talking about telemedicine and remote access, I guess it ties back in that way, and, you know, just of interest to maybe talk a little bit about that.
Well, Calder doesn't have any specific apps that we promote.
Okay.
I mean, other than apps for like our resources, of course.
Sure. Right, of course.
But I mean, we like everyday apps that we use every day have some kind of component in it. So for instance, like last year, Apple launched the ability for you to download your electronic health records on your iPhone. You know, that was like a major deal for them. Like for instance, you can go into your iPhone, look up your providers by region, and download your, I haven't done it myself, but I wanted to check it out because I read about it and I was like, wow, this is amazing.
Sure.
A little bit, it's kind of scary too because of security, but you know, the ability to do that is there. They also launched something very, very small, but it still kind of ties into the whole telehealth thing. So fall detection, like their new Apple Watches have fall detection. So if you fall, or if it detects that you fall, your Apple Watch will dial 911. I mean, you know, there are things that are happening with telehealth within our everyday lives that we don't even notice. I mean, I think you mentioned Amazon has a telehealth division, so that will tie into like Alexa, you know, Alexa, call 911. So, you know, there are things that are happening all the time that we may not be aware of that has integrated telehealth into it. So when you said earlier that telehealth is here to stay, it's been here for a while, and I think it's just going to get even more and more involved in our lives.
Yeah, absolutely. And I guess then from the association standpoint, you have to take all of those things into consideration when you're thinking about, you know, updating standards. Okay. All right. Well, I think I'm a little bit over time, so I'm going to go ahead and thank everyone for joining us today. Thank you to our STEAM panel. This was really informative and very interesting. We appreciate all the thought that you put into joining us today to talk about this important topic. As I mentioned, this will be recorded and available on our YouTube page. And certainly, if you have any questions or you want me to connect you up with any of the panelists, you can reach me at my email here on the screen, and I'd be happy to do that. So thanks again for joining us today, and we look forward to seeing you again sometime soon. Take care, everybody.